Welcome everyone to today's roundtable. This is a roundtable series on reducing mental health stigma, and today's topic is the role of the media in reducing stigma. My name is Jim Rodriguez, and I'm the facilitator for today's panel discussion. Before we get into our panel, we'll have a little housekeeping in a minute. But before we begin, I just wanted to have a couple of folks introduce themselves and welcome you all two of our sponsors, or I should say our two sponsors, Suzanne Feeney from the State Office of Mental Health and David Minot from Mental Health News Education. Suzanne.
Thank you so much, Jim. Good afternoon, everybody. Thank you for joining us. Thank you for taking time out of your afternoons. We are really excited because today is a very important milestone in the Office of Mental Health's work overseeing our strategic plan for statewide stigma reduction. Today, as you know, is the third of 4 mental health roundtables, and our partners, Mental Health News Education, have helped us choose the panelists and prepare extensively for today. We are really grateful to our panelists, representatives from the media community who are with us today to help us have an in-depth discussion of how mental illness and mental health are portrayed in the media and how we can work together to potentially improve that. We hope that you find today's discussion meaningful and that you join us for the last in our series of 4. In addition, please be on the lookout for the second special edition of Behavioral Health News, which will be dedicated to stigma. That is going to be published by Mental Health News Education, and it will be called Stigma and How We Can Make a Difference. Now, the call for articles for this special edition has come out, and we would welcome your input through an article to be submitted. Thank you again for being here today. David, please add your comments.
Thank you, Suzanne. So my name is David Minot. I am the Executive Director of Mental Health News Education, the nonprofit organization that publishes behavioral health news and autism spectrum news. Our mission is devoted to improving the lives and delivery of care for people living with mental health concerns, substance use disorders, and autism, while also supporting their families and the professional communities that serve them by providing a trusted source of science-based education, information, advocacy, and quality resources. In addition, we provide a platform for our readership to communicate and discuss important social issues in an effort to reduce the harmful effects of stigma in the community. You can access our free library of over 2,500 educational articles in both publications by visiting mhne.org. As Suzanne mentioned, part of this collaborative project is for us to publish 2 stigma-focused issues of behavioral health news. The first issue was focused on understanding the impact of stigma and features over 25 quality articles written by experts on the subject. You can view this issue online by visiting behavioralhealthnews.org/archives and click on the link for the summer 2022 issue. We will also post a link in the chat. The announcement for the second stigma-focused issue of Behavioral Health News has been sent out with a call for article submissions. The theme for this issue will be Stigma, How We Can Make a Difference. We will post a link in the chat for you to view this announcement in case you might be interested in submitting an article. And now I would like to introduce you to our roundtable facilitator, Jim Rodriguez.
Thank you, David. And just a quick shout out when David says experts in the field, the first edition, the first issue on stigma, experts included researchers, clinicians, and people with lived experience. So all are invited to submit articles. So very quickly, we're going in the media when they're covering a story, questions like, are the behavioral health conditions relevant to the story? What is the source for diagnoses when people in the media are sharing diagnoses about the subjects of their stories? The importance of words, of course, using people first language, people with mental health challenges as opposed to defining people by their mental health challenges, and then avoiding stigmatizing language. And I won't even repeat them because I think we're all aware of some of the very many ways in which we use inappropriate language to talk about mental health issues. And then reporting behavioral health facts, behavioral health challenges. For example, the behavioral health challenges are nearly as common as physical health challenges. They're very common out there. We often don't talk about that. We see that as oftentimes behavioral health challenges as being smaller and well-defined, smaller defined groups. And then discussing and emphasizing the importance of early identification and intervention. So thinking about getting people help. Some of the panelists that we have do that work, providing treatment options and educating folks about what they can do to get help. And then highlighting recovery through the stories that people tell. So with all of that as a background, I want to move into our panel discussion today. But before we introduce our panelists, we have a small exercise for you all to engage in with us. So again, we're very aware of oftentimes the stigmatizing language that is used in the media. So one thing that we wanted to ask folks to do is we're going to have a word cloud activity, and David is going to put in the chat a link to a word cloud that we can all participate in. And what we'd like you to do is indicate the words that you would want the media to associate with people with mental health challenges. And so we invite you to do that throughout the course of our panel discussion today. And we're going to revisit that word cloud at the end of our discussion. So as words come to mind during the panel discussion, please feel free to add them. And so just to introduce our panelists now. So we have an amazing panel. I will just say very quickly, Brigid Jaipaul-Valenza, who's the managing editor and does a show called Buffalo, What's Next? That show came after the mass shooting in Buffalo, in the African-American community in Buffalo, and she began to do some work. Unfortunately, she's unable to be with us today for health reasons, but the remainder of our panel is going to provide amazing information for us. Ellen Barry, who's the mental health reporter for the New York Times, Daniel Bergner, who's an author and journalist and a New York Times Magazine contributor, Christina Caron, a reporter for the New York Times, Lindsay Holmes Brech, senior wellness editor for HuffPost, and Miche Kirsch-Ito, communications program manager for equity and belonging at Vibrant Emotional Health. I love that title, Miche. And then we have two researchers, prominent researchers in this area, who are going to also be joining us and responding to our panelists. Helen Maria Marilena Lecas, who's with the Nathan Klein Institute and has done quite a bit of research as a sociologist in addressing issues of mental health, mental health stigma. And then Phil Llanos, professor at John Jay College of Criminal Justice, who's written extensively on mental health stigma and also very specifically on the media, the role of the media. I did want to mention very quickly that in preparing for this panel, we made a very conscious decision not to focus on the things that the media does wrong, mainly for the concern that all that does is reinforce the negative themes that are already out there. So we instead want to focus on how the media can help to reduce stigma. And in that spirit, the panelists that we have, the folks that we have on our panelists, are deeply interested in the subject of mental health and mental health stigma. And it's our hope that we can learn from them, that they can learn from each other, and they can learn from us as well in terms of what the media can do to reduce stigma. So in that vein, I'd like us to start off. And with our panelists, I'd like to start off with, in general, the role of the media. So keeping those primary methods of stigma reduction in mind, as we mentioned earlier, education, mental health literacy, contact and protest, what can the media's role be in reducing stigma? From your perspective, what are the things that the media can do, thinking about those areas of stigma reduction? And
Okay, folks. Yeah, Jim, thank you for starting us off. And first of all, I just want to say thank you and welcome to my 330 new friends. I am so excited to share this space with y'all, and especially the awesome panelists that we have here today. My name is Miche Kirsch-Ito, like James mentioned, and I use pronouns like he, they, and we. I'm from Lenape, Delaware, and Susquehannock land, also known as Philadelphia, and I'm currently on Canarsie and Lakawe land, also known as Brooklyn. And some of my specialties are around comms, like for nonprofits and about mental health and social media, especially with lenses towards equity, neurology, and what I am going to call trauma-informed storytelling. And that's where we're going to dive in. So first things first, I think it's important for us to identify who we are as storytellers and why we are storytelling. I think a lot of times as people who have been chosen into these positions of privilege to tell stories, and I will also name that I, as a white person, am often put in that privileged space to tell stories for not white people. And I think especially when it comes to the nuance of race and mental health, it is so imperative that we step away from being, I'm going to use a term, framers of others' experience, and step into figuring out, where we as these radical storytellers on call can use our superpower of publishing, of connection, to do the kind of transition of bringing these stories that are out there and the education that's out there into the spotlight of advocacy and protest. And I think that's a lot of the folks on call here today. I'm already seeing Daniel. That's kind of the processes that we live by. So I'll stop talking now. Let's get into it.
Thank you, Mika, for that comment. And I just wanted to also just give a shout out again. The second roundtable focused very much on that issue. And what came through in that roundtable was the importance of being able to tell the stories of folks with lived experience in their full and total, with all their identities in mind, and not just being seen as people with mental illness or mental health challenges, but other aspects of their identity. Daniel.
I wish I had a breakthrough answer to your question on this topic. I decided to go next precisely because I don't, and because I hope the people who follow will have smarter answers. But I guess I just want to emphasize what may be obvious, and that is our work needs to be deep in its contact with the people we're writing about. We need to do a lot of listening. I know there's at least one person here who's been a very patient and wise teacher of mine, sending tons of gratitude in his direction. That we need to paint full, complex, nuanced portraits of people, not of diagnoses. And then just quickly, and I know we'll probably get to this topic in depth later, that, when we're dealing with really dramatic episodes and sometimes with violence, that we just remember and maybe find some way to remind readers that these are tiny percentages of the people who struggle with mental health challenges. And that even then, that just doesn't come anywhere near to erasing the human complexity that we're writing about.
Thank you, Dan. Others want to chime in? Again, the media's role in reducing stigma, again, along those.
I can chime in a little bit. Oh, sorry.
All right, let's go with Lindsay and then Ellen.
I was just going to say, I know a huge part of our role as reporters and as editors is to make sure that we highlight people with lived experience, whether that is in, a feature story or even a story just reporting on something that happened in the news. I personally work with more feature content and expert-backed advice and service content. So we do a lot of stories on recognizing signs of mental health challenges and do a lot of work in explaining how vast this can be. I think that educating readers on, the fact that this is a very prevalent part of life and it doesn't define someone's life is incredibly important. So just making sure that we're communicating how universal this can be and how it really doesn't define someone is really important. And I think that stretches across any type of story that we do as journalists.
And Ellen.
I'm Ellen Barry. I work for the health and science section at the New York Times. But I would say that at this point, many of our reporters are writing about mental health in one way or another. It's really like permeating all of our coverage in lots of different ways. I'm really glad to be here because I want to be in touch with you. I want story ideas and I want to be talking to all of you. So I hope you will use my contacts and reach out after we finish. I think with newspapers, there is a default to writing about worst case scenarios and acts of violence. And that is the way it has been for many decades. And I think that we are in a moment of real revolutionary change in our culture where this part of our life, our family life, our experience, which has been private or secret, is really coming out into the open, that people are holding employers and workplaces and schools accountable. They're asking for accommodation, and they're asking for all these issues to be out in the public domain, and trying to capture that in the newspaper is a challenge that I am struggling with. But I think that is, at least for me, the way to work against stigma. I wrote about a little town in Connecticut where a school board voted down a mental health clinic. And a really surprising thing happened, which was that a bunch of students began to protest. They began to get up at school board meetings and talk about their own journey, what had happened to them in the 8th grade and the help they got and what it did in their lives. And I think maybe that's the most important story I've covered on this beat, because it just showed that that something's changing.
Thank you, Ellen. Thank you. Christina, any thoughts that you wanted to add, just starting us off?
Hi, everyone. So I'm Christina Caron, and I work for the Well Desk at the New York Times, which is, just as it sounds, we cover all forms of wellness. And my specific focus is mental health. And we try to produce journalism that can be very practical for our readers, in addition to also doing enterprise and feature stories. And one of the things that I think is really important to keep in mind is that even when we're writing about perhaps a very small percentage of people who might be experiencing something, and it's true that sometimes the subjects we write about may only affect a very small number, that's still an incredibly important group of people. And I think that it's part of our responsibility to help readers recognize that. So I agree with what everyone's been saying so far, that it's going to be very challenging to try and eradicate stigma, because a lot of what the media does is reflects what we see in the broader culture. But there's so many little steps we can do as journalists to try and make our coverage as fair and representative as possible.
You know, and when we talk about the challenges, and so what I'm hearing is, and I think many folks who work in this field have been encouraged by seeing the elevation of mental health issues in the media, in some ways in positive ways, with, you know, celebrities coming out and talking about their mental health challenges, and the coverage of stories generally about mental health. What I wanted to sort of shift to now is those standards that we talked about a little while ago, the standards in journalism. If you can give us some insight, I know you all are folks who are working in this space and really trying to advocate and share more, but I wanted to know if you can give us all some insights about what are the challenges. And I'm not talking about the stuff that is, you know, sort of obvious, you know, clickbait and other ways in which, you know, mental health and mental illness is sensationalized, but some of the other struggles that you as journalists or others, you know, might have in getting those addressing those standards and really doing journalism that meets those standards. And also, if you want to comment on the limitations of those standards as well. Does anyone want to sort of start us off?
Oh, if you insist. So I'll offer you a view into kind of this mental stew that I'm building right now. And I think part of this question around, sorry, I'm taking a second to sort of sort my thoughts. I think part of this question around how we do language, and like this specifically to go to this portion of strengths-based language, a lot of folks kind of don't understand like the why on that. And I know I didn't for a very long time. But even if you think about it this way, like here, what we're talking about today, people are saying like, yeah, mental health issues. Where's the mental health wins? I have some mental health wins. Like that's kind of the thing, is if we're always portraying mental health in conjunction with issue, how do we talk about the joys of it? And I think a lot of folks are feeling, especially in this time of grief, in this time of losing loved ones, whether it be to structures, systems, or illness. There's kind of a lot of reasons for us to feel the upsetness. But I think a lot of folks also forget that part of covering mental health, and for myself as a marketer, it's like part of representing mental health services, is talking about not just like someone was so bad and then we saved them. That's like a very white supremacist, white savior mentality. The real thing is this person was having a tough time and now they love life. They got a chance to go to the library and read their favorite book. And understanding that like starting stories from there is a really beautiful place for us to start, because then we get into a lot of different kinds of richness about what mental health means, is, looks like, and is lived as, instead of these kind of abstracts that sometimes, because they're too simple, really kind of obfuscate the real story.
Right. Thank you, Mika. Ellen, please.
Am I muted? Can you hear me?
You're good. Yep.
Yeah, so one kind of standards issue that I have been mulling over a lot, and I'm interested in what people have to think about, have to say about it, is we want, obviously, to feature the voices of people about their experiences. We want to hear from people, and we, especially when we're writing about young people and adolescents, we need them to be the main character. We need them to tell us what they're encountering, what they're seeing. But we also need to be very careful about exposing them to maybe an unpredictable fallout. Being in the New York Times is it's hard to predict what it's going to feel like. And so we're always working on this balance between featuring people who want to tell their story and not exposing them to, what could be an overwhelming situation.
And Ellen, I know you shared a very specific story about that. Do you mind sharing it again? Around a subject whose identity you masked, and it was a kind of editorial decision.
I don't think that was me.
Oh, sorry.
But for sure, especially when writing about adolescents, people who may be under the age of 18, sometimes that is a standards decision that it's just considered to be the most protective or safer route not to use a full name.
Right. Okay. And I'm also identifying a tension here, because as Mika was saying, right, it's important oftentimes to start off with the possible joys and not making it. And I think in those standards, we talk about, standards address the issue of talking about people's stories of recovery. And Daniel, I wanted to bring you in here because I know sometimes, right, the stories might not, and I wonder about this, and I wonder for our audience as well, the stories might not be stories fully of recovery. Necessarily, or recovery in the way we think about it. And so certainly, kind of being strengths-based, but also sometimes the stories are not necessarily happy endings, so to speak.
I don't, when we talked earlier, I'm not sure I said that because I'm not sure I even think in terms of recovery, non-recovery. That sounds close to an either or that I just kind of refuse. I think what you're remembering when we spoke earlier does go to what Ellen's raising. And that is, one of the stories I told in my book is the story of my brother who, when we were in our early 20s, just to do this real quick, was diagnosed as severely bipolar. There's no question in conventional psychiatry's terms about that diagnosis. We have the records, the hospital records, and yet has lived a very flourishing life after choosing to go off medication and then having some serious worrying moments through his late 20s. But now, we're in our early 60s and he's lived 20 years of just a very flourishing, meaningful life. I think what he would still say is there's still that residual branding that happened when he was in his young 20s that he still feels. And it's like there's no fighting it off. And so when I'm thinking of the really young people that Ellen was referring to, I'm just thinking like, not in our world, because the odds, it's just they're too young to make that choice. My brother can make that choice now to work with me and to tell his story, but I'm not sure a 16-year-old, even with their parents to help, can make that choice, because I still get asked, how's your brother doing? As if he's still sort of teetering on the edge, and he's not.
Thank you, Dan. Christina.
Hi. Yeah. So speaking to what you had brought up earlier about trying to figure out whether certain sources should be anonymous or not, I think you might have been referring to the story I had worked on that was about young children who need really urgent mental health care, and how the number of those kids has actually been on the rise over the last decade. And there was a family in our story who they had a 12-year-old. She had been in therapy for many years. She was coping with sensory processing disorder, attention deficit hyperactivity disorder, anxiety, and she had first become suicidal at the age of 8. Her family, clearly had been dealing with a lot over the, for the entirety almost of her childhood, and they felt strongly that they wanted to be known. They felt that that was one way they could help erase some of the stigma. They didn't want to. They felt as though it wasn't necessary to hide, and this was not just coming from the parents. This was also coming from the 12-year-old too. However, then it became our responsibility as journalists to listen to that and then say, well, how do we know that this 12-year-old would feel the same way 5 years down the road, or even 2 years down the road? She had dealt with bullying at various points in her life, and it just seemed like a potentially risky proposition for a group that had never been in the New York Times before, didn't know potentially what that might open up for them. It could open up a lot of wonderful things, but also maybe some unwanted attention. So it was a big conversation with our standards department and with the family. Again, I asked them to really think about this. They came back and said, no, we want to do it. And in the end, we felt, it probably wasn't going to serve her well to identify her in this way at this period of her life. And we all came to the consensus, family included, that, let's just stick with like a first name in this case. And I think in the end, actually, they were happy with that decision. But I understand completely also their point of view. And there were people within the company who sided with them too. It was a tough decision, and they have a point. I mean, but when you're talking about a young kid, it makes it even more fraught.
Right. Thanks for clarifying. I got my New York Times reporters mixed. Any other thoughts though on this topic of the guidelines of how and I hope you. Oh, Christina, you have your hand up again. Did you want to add something? Oh, okay. And as we think about this idea of the stories to tell and the challenges in telling them, I hope our audience is seeing, right, this group is very distinct, right? The kind of thoughtfulness that is brought to decisions around the stories and how to tell them. Lindsay, I see you have your hand up.
Yeah, I just want to kind of underscore the point that's already been said, but it's an ongoing challenge, I think, and it's not something that is necessarily a challenge that will be solved anytime soon. I think decisions like Christina's story that she was just talking about, and decisions about featuring people with mental health challenges, especially when they're young people, that's always going to be an ongoing conversation in newsrooms and with standards and with people who have various stakes in the story. And there's a ton of nuance when it comes to making those decisions and also telling those stories. And I think that can be a really difficult thing to navigate for a journalist and for the sources. And it's not necessarily something that is going to be just because, for example, people make a decision one time that, is like what Christina was saying, doesn't necessarily mean that, at least for us in our case, like the next time it's going to be the same. It all is different, and it's always an evolving conversation, which is great because it's always a subject. Mental health is obviously always a subject that's at the top of journalists' minds when they're doing reporting, but also at the same time, like it is, something that we have to constantly be vigilant about and keep talking about. And then the attention and the aftermath after publishing a story can also obviously play a huge role, like people were saying. Just the internet can be what it is. We all know how hateful and ever present it can be, and the comments that can happen, and the things that people can see about their own stories or about stories of people who they might relate to, and then the comments that people say, after that can obviously then accidentally contribute to stigma. So like our goal might be reducing stigma in a story that we tell, and then the comments on that story once it's published are awful, and people who read that might feel good about our story but not feel good about the comments that people leave. So that's a huge challenge that we try and navigate and try and control as much as we can.
Thank you, Lindsay. And Daniela, I see you have your hand up, but I also wanted to go back. Mika, I wanted to talk to you a little bit about specifically around the social media as well, and what we can do with social media, because I know that's an area of specific expertise. But so many of you though now with electronic journalism everything is social media, right? Daniel.
I actually was going to comment on one of the other standards, so I'm okay with waiting.
No, go ahead.
Okay, so this is the reluctant radical in me, but the standard that assumes early identification and intervention, I'm going to say an emphatic yes, but I wish that would have a qualifier, which is you need that. I'm hesitant about the identification, and I'm endorsing the intervention if it's the right and sensitive and nuanced and probably peer-led or peer-included intervention. The wrong early intervention can be devastating.
Can you clarify, Daniel? Just, yeah.
Sure, it goes back to what I said earlier. I mean, if you are quickly labeling a young person and quickly leaping in with kinds of treatment that might or might not be necessary, or might do well with some calibration, as opposed to a kind of all or nothing approach. If you're doing that, maybe that early intervention isn't going to do well, and maybe is even going to cause harm.
Gotcha. Thanks for clarifying, Daniel. Mika, I want to go back to you and get your thoughts, but also I just wanted to mention for our audience, I do see some hands raised. And as we mentioned, I know folks want to comment, please put your comments or questions in the chat and we'll return to them at the end. So I just wanted to mention that again, if it sounds like folks have some thoughts that they have, please share them in the chat. Mika, on the issue of social media and how we can use it, and of course, what the challenges are there as well.
Of course. So I'm actually going to shift into my neurology brain for a little bit. That is also one of my faves. And talk a moment for about social media. A lot of people talk about like social media addiction. And I think this is like something I keep rubbing up against, of people being like, social media is bad, and using this word addiction in like a metaphor for it. But, let's take that framework for a second. Let's take a mental health framework to it. When we talk about addiction, it's like a narrowing of things that are joyful to you. In a lot of ways, people forget about that part. So using that kind of lens to it, asking yourself on the social medias, what are we bringing to it? What is the algorithm serving? And we are asking people to find our content joyous. Are we giving them joy? And some of the kind of back and forth of that is like, how do we talk about mental health on social media? A lot of folks are kind of into this phase of speaking about like, what is mental health, defining mental health for like the DSM definition and for the definition of a person living their life. And I think social media has this unique ability for us to start closing some of these gaps for people who may have a lived experience definition and people who may have an academic definition get to be in conversation. So in that sense, social media is beautiful and awesome. And still, it is a gamified structure. So when we look at this conversation, again, to bring it back to this like touch point, the joyous part of social media, it is again narrowed by who you interact with. And so a lot of folks see social media, again, in that way, narrowing the things that we like. So the question for, I think, myself as a social media person who like makes things that go out in the world for professional and personal reasons is always like, what is the artifice of it? If I was to show this to any old person, what would they think? Literally anyone, and they have to feel similarly about it. So how do we talk about mental health in a way that the academics are included? We often include the academics. They're kind of easy to include. They gave us a lot of cool words. But how do we include the everybody, the people who are receiving services, the people who are like, I don't believe in mental health, the people who believe in mental health, but don't use the word mental health to believe in mental health? All those kinds of people get to interact together. And that's why social media is like such a specific place where, again, it's interaction based. So to wrap it all up, when we are talking about, what is the role of social media in mental health? Social media is a gamified thing that will affect our mental health, point blank, period. What do we do with it? What do we put on there is the question that is often like asked around. How do we solve it? Is what do we put on there? I can't give you a perfect answer, but I can tell you that all of these structures are the things that you have to have in mind when you are putting something out there so that we can check joy on all of these boxes. It is a joyous thing that we are putting out strengths-based language. It's a joyous thing that it's accessible language so anyone can understand it. It's a joyous thing that it's a shareable content. So if people who are academics in circles can share out to their circles. Yeah. It's like a lot of nuance with audience building that comes into like the social media and mental health component that I'm not going to lie, we are pampered. Y'all journalists, I don't envy journalists because y'all don't get the feedback that I do. I have a lot of data that tells me when I'm doing things, but I think that is an immense privilege of social media as well.
Thank you, Mika. And actually, I want to take that. That's a really great segue because as you talked about the choices and not only the choices in what we choose to cover and how we say it, but I think and how we report on it, or how you all report on it, I should say. That's a good segue. So the focusing on the issue of contact but also in whatever way you cover it, not just contact, but I often see journalism being a great vehicle for contact, right? Telling the stories of people. What are some of the considerations you take into account when seeking or reporting on mental health? What are some of the things that you're looking for? I think Mika's point, right? About, what are the stories we're telling? What are you looking for? Christina, great. Thank you. Lead us.
Well, I thought those were a lot of great points. And one thing the media is very good at is pointing out problems. They're excellent at that. And what I think we need to do more of is also incorporate what are some of the solutions people are working towards within the stories that we're writing, even if it's just a brief part of the story. Maybe it's the entire story. That's far less common to have a solutions-based article. But having even just a small part of it talk about, what are people trying to do to address this can be really inspiring to our readers. And I've gotten feedback that, I wasn't aware of that. Our school has the same issue over here. I am going to try that same thing that other school did, and it's just a great way to help educate people who are struggling with the same problems.
Thank you, Christina. Lindsay, see you have your hand up. Oh, and then Natalie.
No, Christina hit the nail on the head, because when I'm looking for stories, I'm sorry, I don't even think I really went into a full introduction earlier, but my role at HuffPost is I work on our what we call our service journalism team. So we do a lot of solutions-oriented journalism, a lot of expert-backed advice, and things actionable things that people can take away from whatever story that we're writing. So I think, to Christina's point, it's incredibly important to include solutions or at least offer some expert insight on what people who are reading the story can do if they feel like they can relate to whoever we're talking about or the issue that we're talking about. And I also think that looking for people who have that lived experience, like we were talking about before, is incredibly important, because it's one thing we do rely on a lot of experts for our stories. We talk a lot about different mental health challenges, different diagnoses, and it can kind of feel a little clinical or like we're talking at the reader. So including people who have that lived experience and can really share like how it has affected their day-to-day life and how they are personally dealing with things too, I think is really helpful to have that mix of both. So that's what I look for when I publish our pieces.
Fantastic. Ellen, please.
So one thing I've been thinking about a lot is trauma, because often we meet people at the worst moment of their lives, or we ask them to walk through the worst moments of their lives. And I've been on both sides of that, actually. And what I hope is that we're evolving in how we do this, but that somehow when you work with someone, that you don't leave them at that low point, and that you also sort of prepare them for the much bigger experience of sharing something so intimate. Often someone asked me a really smart question on the chat, Sylvia, is the attention of the media good or bad? And I would say the answer is yes. And often at the same time, it's good or bad that someone makes a huge leap of faith to say something they've never said, or to be very vulnerable. And they do it for a reason, but you have to walk them through it and sort of set them down as gently as possible, because I just think I'm much more aware of that than I was when I was a 25-year-old reporter. And it's something that we're really taking people in our hands when we interact with them.
Great, thank you. And Mika, yes, your thoughts.
Yes. So first of all, and I just want to say a wonderful point, and I'm going to pull the transitions. As a 25-year-old reporter, I'm not a formal reporter, but as a 25-year-old storyteller, I think a lot of the sensitivities that we need to kind of garner for this moment And I keep coming back to the phrase that you said earlier, Ellen, like sometimes we are meeting people at the worst moments in their life. I, as a mental health advocate, et cetera, what have you, have been training for, I'm not joking, years to become a peer. And that is to become good at telling my story, to become an advocate around telling my story, to really garner those skills towards storytelling. That is my goal. I've been working on it for years. And like Ellen said, quite often you are just meeting people who are at a beginning point, if not in their journey with the thing that they're talking about, at least in the journey of storytelling. And I think that is also one of those grounding points of privilege for we as storytellers, as writers, as people who have conversations. That is our skill set. So I just want to reinforce, Ellen, exactly, like holding people, I think is so the core of solving a lot of our problems around how we frame mental health.
Thank you. And Christina, I'll give you the last word on this topic, and then we're going to switch because I want to get our two researchers on. So, Christina.
Thanks. I'll keep it really brief. No, I was just piggybacking off of that. I was just going to say it can never be just one conversation. And it doesn't matter if that is a person with lived experience or an expert, at least in my case, as long as you're not, in the midst of breaking news where something has to be done yesterday, immediately. If you're taking the time to talk with people, you've got to go back to them multiple times. Because oftentimes as journalists, we're covering subjects that we may have never written about before. We write about so many different things, and we can never, there's so many ways to get nuance wrong, to have the slightly wrong interpretation of something. And that care is so important. Yeah.
And just as a quick segue, we'll segue to our researchers, but I just hear, so as a therapist, I would see part of my role is getting the narrative, is understanding people's stories. But I also think, to segue to our researchers, I always tell, as a teacher of research as well, I used to tell my students, research is storytelling too. So I want to transition to our researchers and have Phil Llanos and Marilena Lecas share their thoughts. And Phil, starting off with you, your thoughts. I know you've done a lot of research yourself and a lot of thinking around media and social and stigma.
Thanks. So my name is Phil Llanos. I'm a professor at John Jay College and a stigma researcher. And I just wanted to just maybe start by just summarizing some of the things that we know about media and stigma. And then I just wanted to pose a question, if that's okay. So these are some of the things that we know. So we know that large proportions of the general public report that what they know about mental illness comes primarily from mass media, such as newspapers, television, and the internet. And we know from content analysis research that news reports about mental illness disproportionately discuss it in relation to violence, and that these types of reports are disproportionately featured in prominent sections, such as the front page or the top of the website, I suppose. And we know that the great majority of criminal behavior, insofar as it is engaged in by people diagnosed with mental illness, has nothing to do with mental illness. It's accounted for by the same factors that explain criminal behavior in general. And we know the Carter Center guidelines say that mental illness should only be mentioned if it's relevant. But mental illness is almost always mentioned as a background factor in relation to crime if it is known, or even if it's mentioned by a non-expert. And we know from experimental research that mentioning mental illness leads people to believe that it's causally related to instances of crime and violence, and even to develop false memories about how it's connected, thinking that specific symptoms were involved in it. And we also know that this reporting has real consequences, such that exposure to these types of stories increases the endorsement of stigma. And it's been suggested to be related to a population level increase in the expectation that a hypothetical person with schizophrenia would be violent in the United States between 2006 and 2018. So with all of this established, I guess what I would ask the panelists who are advocates and who are sort of working against these trends or these predominant forces. What do you think that you can do within the publications that you write for and the general culture, within the professional of journalism? What can you do to change this? Because it seems like we're up against quite a bit here, and its effects are quite profound.
Daniel, please.
So I want to answer by asking you a question, but here's the frame I would put on the question. So yes to all you just said, and yes to the research that says that the disproportionate commission of violence by those with mental health issues can also be explained by issues of poverty, homelessness, etc. So that it's not, causality is not clear. But I think what happens is, and the habit you're talking about comes out of a kind of hope on the journalist's part to see the crime, the act of violence, in a very humanistic way, so that when paragraph 2 or paragraph 3 goes into mental health issues, the conscious attempt is not to stigmatize, but it's to humanize. And it's to also secondarily sort of make an implicit plea for more care. However, as you say so concisely, the outcome is that we associate serious mental health issues with violence in a way that's way out of whack with the reality of that connection. So we've created this Halloween sort of subconscious out of this humanistic impulse. And my question is right back to you. What should we do?
It's easy. Stop mentioning it. Just like race isn't mentioned, it should not be mentioned. That's an easy answer.
Ellen.
I mean, for the sake of argument, I guess I would say that it is a way of writing about a broken system, that generally when you dig into what went wrong in a bad outcome, what you discover is something that is manifestly clear to all of you on this Zoom, which is that there's no continuity of care, there's no wraparound care for most Americans in most American cities, and this is a crisis for anyone who loves someone in that situation. It's hard to write about, except in those situations where there's a bad outcome. And so we all like to think of ourselves as righteous when we write something and make it into news. It's for a reason. And I would say that a lot of those stories that you're referring to, I mean, maybe the justification is to call for change in mental health system, to call for more supports.
Maria Elena? This is a perfect time to bring you in because I know you have many thoughts about this as well.
Actually, I think Daniel and Ellen said it all, said what I wanted to say and how I wanted to answer Phil's question, which is talk about the structure, talk about how poverty and homelessness and racism and homonegativity and all of these things lead to very negative outcomes. Talk about the structure. And when we had a pre-meeting and we're talking with Jim, one of the things I thought is the story I would love to see after all these years is challenge the system. Where is the system? Where is society? When somebody says somebody pushed in the subway and this person was out of treatment and homeless, I'm like, whose responsibility is? We rarely hear the story. And you know, it's you all touched upon it. You know, Christina said, let's talk about solutions. And my immediate reaction was, let's talk about societal solutions. Let's not just make the intimate partner, the family responsible for this enormous burden of taking care of somebody with mental health challenges. It is our society's responsibility, and I think you all touched upon it. We talk about recovery, right? We talk about how this is accomplished. I have even an issue with interventions. We have to move beyond interventions into social change. And I'll tell you why, because protest and advocacy doesn't go far enough for me. And contact is about bringing people and interacting with people with mental health challenges. I want to challenge us all here and say, don't interact, integrate. We know that community-based services work, yet we don't fund them at all, or we underfund them, right? We know that engagement in a community and love and care have tremendous healing potential. We don't hear those stories. And clearly here I'm talking to an amazing group of people that are on the right side and are doing the right thing. But we all spoke about how stigma is so prevalent in culture, right? So the way to change culture is this: start holding responsible all of us, for, don't talk about the person who pushed another person. Talk about, where is the clinic here, right? Where are the housing resources? And oftentimes they hold responsible their family, which is, the people who are exposed to courtesy stigma or stigma by affiliation are further stigmatized for not having their person taken care of. But there are a number of other interesting things that were brought up, and I want to go back a little bit. Like Micha brought up the whole notion of what I would call medicalization. Right? The language of medicalization that academics, and I hold myself responsible for that as well to some extent, use. And calling, I think, Micha, you called for demedicalization, a language where we humanize the person. And I say, yes, humanize people, but also put them in social context, right? And, Daniel, you spoke about the correct early intervention, and I really like that. And I would like, in my line of work, we talk about appropriate services at the right time, but the right services. And I want to challenge us all and also think that not everybody has access to appropriate services at the right time. The example I'm going to bring is attention deficit disorder, autism. We know that minoritized children are diagnosed far later in life with autism, for instance. So, Micha spoke about the privilege, the advantage of being white, non-Latinx and talking about other groups. So if this is a form of privilege and advantage, and I suggest that we use it to expand the conversation and not stay with disparities. Start using the language of inequities, right? Unfairness. Christina, you spoke about, telling a story that is fair, right? And you yourself said stories about solutions, not just problems, are less common. And again, I thought, yes, solutions, social solutions as well as interpersonal. I think we have locked in for many years, and that's my pet peeve, or not even pet peeve. It's a large concern. We lock the term stigma into internalized, anticipated stigma and interpersonal. Stigma is structural. Stigma is discrimination. Stigma is exclusion from opportunities, and that is the story I would love to hear. And I want to go back to something that Ellen said, because it really struck me. You said, Ellen, a lot of people are writing these days about mental health, right? And we're a moment of revolutionary change. And I love that. And I think we are at that moment because with the COVID pandemic, we recognize how fragile everybody's mental health can be and is. And it's a way to normalizing having mental health challenges. But it's also a moment where we can talk about institutions. We can talk, you mentioned the example of the students in school, right? We have to talk about our workplace, schools, community settings have to become responsible for mental health. We can't just keep it at the interpersonal or the patient-provider level. And stories about, strength-based stories and wins, I think they're important, but I think it's important to talk always about the context into which these stories happen. In my experience and in my research, I have found the people that are more likely to have stories of wins, success stories, if you will, although this is not maybe a good term, are the people that have the most resources. And I think that's something we have to think, resources associated to race and class and gender. So let's think a little bit about that and write stories about that. So my last, if I will, if I may rather, I'm a sociologist by training, so it's a weird accident that I end up in a department of psychiatry. But I would like to take the liberty of reading something from one of our founding fathers. I'm going to date myself, 1959. C. Wright Mills wrote The Sociological Imagination. And the panelists today have that. I suggest you take this and you spread the seed to your colleagues. He said, neither the life of an individual nor the history of a society can be understood without understanding both. The sociological imagination enables us to grasp history and biographies, stories, and the relations between the two within society, within the social context. This is its task and its promise. So I would like to expand this call, although he wrote it for sociologists like myself, I would like to expand this call and this invitation to journalists and say that the political task of the journalist is to translate personal troubles and stories into public issues. And I thank this panel. It was a wonderful experience.
Thank you, Maria Elena. And so I want to switch now to the audience and questions and story ideas. I'm viewing a few already, but also quickly, just as a little transition, David, do you think we can pull up the word cloud while we're just transitioning into Q&A and just get a sense of what folks said? Wow. Thank you, David. So these are the words that people put in that they want associated with mental health. And actually, our discussion, and thank you, Mika, for reminding us, right? Mental health challenges and mental health issues in itself, right, becomes, even though it seems to be sanitized, or we try to sanitize it in that way, it's still, right? So these are the words people want associated with stories about mental health. Do I have that right, Mika? Right? Strong, resilient, recovery, hope, capable. Please feel free to join me in pointing out any of the ones that pop out to you. Strength, understanding, focused, recovering. And that little kind of contraction is about more words being added. So human, capable. Anything pop out to others? Courageous.
I mean, I love that I saw at one point on there working woman, because I think that is like, yes, so true. I think getting into class, getting into working, yes.
Yeah, and I think many of the points that were made here also about getting behind it. And Phil, I'm not sure your point about not addressing it. I'm not sure if that answer was sufficient. And at the same time, what I'm hearing is that it's the story behind the story and the depth and the full and complete way that we talk about mental health, but also people when we're the people behind those stories. So very quickly, I'll leave that up while I pull up. Please, David, feel free to leave that up for a moment while I try to sort of look up some questions here. I think some of the issues we have addressed, the notion from Thomas O'Hanlon, the question of when bad things happen and the alleged perpetrator and the media reporting on mental illness in the previous history. I think we address that. Negative effects of mental diagnosis when you need medical treatment. For example, I was acting confused, and a tiny rural ER tested me for illegal drugs. Test was negative, so they sent me to a psych ER, but I had a medical issue that could put me in a coma. It was a bad reaction to medication. Yeah, and I think oftentimes the story that you might hear or people's experiences that you might hear about might get it wrong. I hear a lot of the folks on our panel have talked about a little bit more about moving beyond, right? So the immediate reaction is to share a story about a bad experience. But does anyone want to talk a little bit? And I believe we have a couple of folks, this intersection of health and mental health, and oftentimes how those can be conflated. Does anyone want to address that? I know.
All right, sure. Again, if someone else would like to jump in, please let me know. But I will stand in this moment as someone who is disabled. I call myself disabled in the sense that I refer to my most often physical disability, but I am also someone who has a variety of mental health stuff going on. And I think in a lot of ways, I think Marlena said it so beautifully, the medicalization of language is, I think, often where a lot of folks kind of hit that intersection of where health and mental health hit each other, and maybe not going the other direction of like, how is the emotion in my body reflecting in the physical health on the doctor's chart? And so I think, getting that sort of like interrelatedness between health and mental health has always been an interest of mine, as someone who, whether it's working for my own position as a disabled person, or if I'm working with other folks in my life who, maybe don't have all of that academic-y language. Like my dad will not tell me that he's anxious about a meeting. He'll be like, yeah, my stomach hurts so bad, I couldn't even think about eating a burger. And I have to kind of think through what that means for him. So I offer that I think often mental health and health are back and forth, separate, et cetera, mental health trying to be kind of subsumed into health, but to back all the way up and say, how's your body feeling?
Yeah. and we know actually that debate is kind of done. It is both. It is both. And I think oftentimes, just as much as we conflate mental health and these other things, violence and criminality and other things, but we also miss the connection between health and mental health. And again, I know we have folks who work in that space as well, and connecting those dots and raising awareness. I don't know if others, Lindsay, Ellen, Christina, if you want to share your thoughts about that as well.
Yeah, I would just say, I would think that it's important for, at least from my perspective as journalists, to report on mental health as its health. I don't think that they should be separate or thought of as two different issues. I mean, your brain is an organ, right? It's a health issue. And the same thing with society, and societal problems, as we were just talking about. People want to address cancer, disability, anything like that. They're all together. Everything is connected. You wouldn't, talk about cancer and not want to talk about mental health. At least in my book, when it comes to reporting, it's all the same to me. I think that we should be talking about it as a health issue and not something completely separate.
Thank you. Any others want to respond to that topic?
I would just say that often, I don't know, I can't tell you how many times it's happened that I am talking to someone about mental health care or their own experience, and there's a desire to confirm the diagnosis, to get a clinician or a physician to confirm someone's diagnosis. And the more I work in this area, the less diagnoses seem useful over time. It feels like it's not giving us as much information. I think maybe what I'm saying is that over time, I guess I would like to move away from using them, because I'm not sure that they're that helpful.
Thank you, Ellen. I'm going to move on. So a big one, and I'm glad we're bringing this up with time. So Venture House Queens, I think there's a psychosocial club here. Story idea, more stories on police and mental health. And I know obviously that's a huge topic. And just from Venture House, we are joining from a psychosocial club. There are several peers and people with lived experience here. From one member, stigma must be stopped by personal experience. See my personal experience in the book lyric for the Bard by Paul Tobia. I guess to sort of bring this, we could discuss police responses to mental health crises and the coverage of it. So again, from your perspective, there's policy issues there and many other issues, but as members of the media, how can we think about, and I think this touches on many of the things we've already addressed, but if there's other angles that you can address it from, but different community roles to respond to mental health crisis. So my understanding of the question is, we can talk about the issue of, this using police to respond to mental health crises, but the importance of others in the community for responding. And I want to make a quick mention, Brigid Jaipaul-Valenza, again, who couldn't be here today. As I mentioned before, not necessarily police in mental health, but she, the series that she does, Buffalo, she does in Buffalo, excuse me, I'm missing it, but she definitely talks a lot about other ways in which the community can respond to mental health crises that don't rely. But does anyone else want to sort of share their thoughts on that topic?
Well, here we are again, but I will jump in since I feel like it's a little bit of a call out. For folks who may not know, I work for a crisis care continuum. Vibrant Emotional Health is proud to be a part of that. And a lot of what we talk about is, who do you call when things go bad, right? So a lot of people know the number 911. They have been embedded with that. I, as an American, have that tattooed in the back of my eyeballs. But we don't talk as much about, where is your local mobile crisis team, right? I don't know that off the top of my head, and I'm in the field. So the kind of conversation is like, there are alternatives for people who are in crisis who have mental health needs, but how often are people knowing about that? How well staffed are those things? And how well trained are they? Not necessarily just in like we're here to help people, but some kinds of people need very specific kinds of help, and that is a benefit and a beauty. And to kind of lean into this idea of moving systemically, I just want to encourage folks to, again, think of the systemic parts and the systemic efforts and how we can kind of align our privileges into that.
And it's interesting because I want to sort of bring it back to our panelists. So the message I'm hearing from our panel, right, is when you tell the stories of people, but I am wondering in terms of covering those systemic issues, if you can say a little bit. I know, Ellen, your example of mental health in the schools and a school mental health initiative is kind of related, but other ways in which you as members of the media can cover those systemic issues, and that often might not be, other than, as we've already said, when things go wrong, right? Which we know sadly happen all too often.
I mean, I think there's so much more activism around getting employers to care for people in mental crisis, and that this is like a disputed area that has not been resolved. But just look at the question of PTSD. So PTSD in law enforcement, in healthcare fields, this is really being negotiated in our society right now. And often it's coming from legislators or it's coming from community activists, not necessarily from clinicians, but like this change is kind of rippling through our society. So that's a way to cover it.
Great. Any other thoughts or want to add to that?
Yeah, I can jump in and just say part of going back to what I said earlier about the work that I do and that we have in service journalism. And like I said, Christina mentioned this with solutions, covering these systemic issues in a way where it's giving people the information that they may need in a very searchable way. I mean, like journalists think a lot about like what people are asking their friends, asking, themselves out loud or their family members are searching on Google. So kind of thinking about that in those ways. We did a story 2 years ago, I think now, where it said, like, should I call 911 if I see someone having a mental health crisis? And that story went into basically how it's not advisable to do that, and all of the ways that things could go wrong, and some better options based on the scenario that you might be seeing unfold in front of you. So I think more stories like that, where it's taking a question that people might have about some of these systemic issues, and then really talking to experts in the field, looking at the research, talking to people who have, solutions for that question, I think is really important to see.
Yeah. Thank you, Lindsay. I hope for our audience, you're seeing some of the tensions in here, but again, the wonderful panel that we have and just how they address these issues so responsibly. I'll take one more because I think we'll be wrapping up. Very specific, Jamie Baker asks about the evolution, a story idea, the evolution of the mental patients liberation and psychiatric survivors movement. And possibly highlighting, this is a story idea. I just wanted to put that out there. The question came up around the role of social media. I think we've addressed that. Phil, you're cheating, but Phil, actually, I did want to bring this up, and I think it's related to the mental patients liberation and psychiatric survivors movement, but peer-run initiatives. So Phil's cheating a little bit as a panelist, but the question around peer-run initiatives, story ideas around that, do folks have thoughts about that? Are you covering peers? And I guess from a different perspective, oftentimes, again, Brigid, who could not be here, she talked about oftentimes relying on mental health providers as the starting point. For stories. So, if she's doing on a story on a particular diagnosis or problem area, she'll reach out to the experts first. But it's interesting, and I think Phil's point is, peer-run initiatives, but how do you get the voice of peers as a starting point? Any thoughts about that? Have you done it? Daniel. And Mika, I could see you. No, I know you want to get in there as well, but Daniel.
Okay, I'll speak really quickly because I know we're running out of time. So, yes, certainly I have done it, and I'll leap from being journalist to advocate for a second, just alerting people in sort of spending lots of time with the Hearing Voices Network and lots of time with people who work within it and write adjacent to it. There is one program that's gaining momentum that deserves a lot more coverage, and it's called Alternatives to Suicide. The way I would call it is just it's a very innovative approach to preventing suicide. It completely eschews control and management of risk and replaces that with connection and the idea that shared experience, no matter how painful and threatening and scary, is going to be the force of rescue, as opposed to somehow trying to grab on, control, and fix. It deserves a lot more attention. Again, people at the Hearing Voices Network can say more about that.
Thank you, Daniel. I'm going to transition because I know we're getting short on time, and there's a few things that we're covering. So let me, David, if you can bring up the slides, and we're going to wrap up. This was an incredible discussion. However, I did want to get to this because all of our panelists agreed, and of course, as you can hear, they want stories. They want story ideas. They want you to reach out. So they've all been gracious enough to give us their contact information. You see it there. David, I don't know if you could put those links into the chat so folks can have those addresses. So you have a group of folks here who want to tell stories, want to share stories, want your story ideas. So for those of you who put out story ideas in here, and I'm sorry I can't get to them all, but you have actually a better vehicle than sharing them here. You can share them directly with our panelists. And so I just wanted to mention that. And please, this is an opportunity. I think one of the takeaway messages that I'm getting from here, we need more stories told by the kinds of folks who are on this panel, in many ways to counter, as Phil says, the majority of the stories and the majority of the coverage that goes in the other direction. So I think that, I really want to encourage you all to follow up and contact the folks on our panel. And then these are some resources that we have available for folks to look at and share. I wanted to highlight that document that we shared earlier, we mentioned earlier, the Carter Center Journalism Resource Guide on Behavioral Health. Of course, journalists can use it, but also you all as advocates and as folks who are interested in reducing mental health stigma, certainly you can reference those when you're trying to hold others accountable to those standards. And I should also say that oftentimes those standards might sometimes fall a little short. And as this discussion kind of brought out, I think that those standards could be so much more broadened. And so those are some resources that are available. And lastly, I just want to put a quick shout out here to our final roundtable, which will be actually in 3 weeks. With a group of folks who have been doing this work for a long time, who've been doing the work of addressing mental health in the community, trying to reduce mental health stigma. So we'll have Glenn Liebman, CEO of Mahaney's, Harvey Rosenthal from NIAPRIS, Dr. Angelia Smith-Wilson from Friends of Recovery, Euphemia Strong from Families on the Move in New York State, Daniel Tan with the New York Coalition for Asian American Mental Health, and Rabbi Simcha Weinstein, who's the DEI coordinator for Families Together in New York State. We are looking forward to a wonderful panel with these folks and moving the conversation about what we can do to remove stigma, not just, of course, on the very important role of the media, but all the other ways in which we can think about it and hopefully have a deeper discussion around some of these systemic issues, which I hope our panelists will be addressing that day. So with that said, I just want to end by thanking you all for participating with us today, joining us in this panel. I want to thank our panelists for an amazing discussion. I want to thank our sponsors of OMH and Mental Health News Education for being a part of this. I hope you have all learned something, picked something up, or understood these issues on a much deeper level. And we look forward to seeing you again in 3 weeks for our final panel. Thank you all again for joining us.